Okay, I'm gonna be like try and be less professional now so I don't mess this up. I literally just hit record and was like, nope, erased. So this is a very like, kind of casual chat. Although it's not so casual because Samantha Stupak is with us and she's the creator of Balanced Health. So this is kind of Emily and I, our new partnership that we're so excited to have and bring to Root Cause Formula. So just a really kind of quick overview of what and how we're incorporating this. And then I'll let Samantha introduce herself and we're going to do a case study for you guys. She's going to go over an actual scan and kind of help us understand how to break this down. What do the results mean? Like, how does this even work? Right. So we do a lot with kind of like energy frequency in our one-on-one root cause formula group. So this is another way to do that through creating balanced health. So Emily and I have created what we're calling our starter kit. And what that includes is a handful of options, which you guys can see on our website. But the first option is to do our core four, which we came up with this idea because we looked at our wait list and thought, oh my gosh, we have, so many people on our wait list, but like, what if we could give them something to do now? So by the time they get into our group, if they still choose to do that, they're even, you're that much further ahead. You've opened up a lot of those drainage detox pathways. So we have, kind of our four supplements or four components that we really feel like set the body up for opening up those detox pathways, which is, binding, getting the bowels moving, making sure there's a gut healing support. So kind of along that realm. And that's one option. And then our other options are going to include ordering blood work. And then even more further, we're going to have creating balanced health scans. So there's a handful of scans, and I'll let Samantha kind of talk further about, how they kind of all work together. But what we're going to go over today, right, is the full scan, which I think kind of goes over obviously the most comprehensive type of information that you can get from these scans. So that's why we wanted to have Samantha on and really kind of just go over like, all right, if we're doing a case study, we did the same thing with blood work. Emily has an amazing, resource. This is a resource for you guys. Now that you've ordered your scan, you're like, okay, if I could watch this and maybe it helps me even understand further what these results are showing me, that would be amazing. So I'll let you, Samantha, take it away. Thank you for being here.
Yes, thank you for having me. I am so excited to go over this with you and to everyone that has purchased one and is going to have the results probably in hand now, if you right now, or probably here within 3 weeks. So, yeah, to give you a little background, Balanced Health, we've been in business almost 11 years. And as you know, we do distant testing with hair and saliva. So the full scan is by far our most popular test. It is comprehensive in terms of looking at everything from every aspect of the body in terms of organ systems and then what's impacting them. So food sensitivities, hormones, things like that. So I don't know. Do you guys just want to jump right on in and start going through a case study? Does
Yeah,
that sound
let's do it.
okay?
Yeah.
So let me share my screen. Mm, Oops, daisies. All right. Can you see my screen?
Yes, we can.
All right. Move this over. There we go. All right, so this is a full scan. And the nice thing is, if you decide to do subsequent testing, the nice thing is on your dashboard, you will always have copies of them. So on the dates they were published, you can toggle back and forth through each of them. So you can check your progress, which is really nice, and see, back a year ago, where were you? What were you low on? What toxins were you struggling with? Things like that. But since this is most likely your first one, this is the system performance. And so this is giving you that indication of different stress levels and where you're holding them. So if you look specifically at this color coded key up here, you can see blue is going to be minimal stress. And that's ideally where you want to eventually have all these systems landing is in the blue. That's minimal stress. Yellow is where stress has started. It's going to be hot. It's going to be acute inflammation. And then chronic stress is in the orange. That's where it's been chronically inflamed or hot for a long time. And then these two areas, so the yellow and the orange, this is where your body is really talking to you, and you hopefully are hearing it and feeling it. It's saying, hey, there's something going on here. I'm giving you these markers. You should be feeling this and trying to do something to help reduce this stress. Now, when you get to the red, this is where it's in a weakened state, where it's saying, okay, I've been telling you for a long time something's been going on. I've been giving you these markers. I've been trying to tell you there's pain here, or there's inflammation here, but I'm tired and I can't do it anymore. And this is now where it's on the in the weakened state. And then of course, maroon is going to be chronic weakness. And it's going to be a little bit more difficult when we're looking at chronic weakness, like here in the liver gallbladder, to get that back in the blue, but we see it all the time. It's quite a bit easier to get from the orange and the yellow back to the blue because that stress just isn't as deep. So, yeah, so we're pulling all this information from your hair and saliva. So what the equipment looks like, just to kind of give you a little bit of a background on how we start the testing process, is we actually put your samples into equipment. It's not massive equipment. I would say it takes up half of a tabletop. We put your equipment in there, and then we use really fine tools. The technician uses really fine tools and probes different areas of the hair and saliva that are representative to different areas of the body. So if you see these 14 systems here, we actually categorized close to 60 different areas, organs, points throughout that hair and saliva that make up these different systems. And so this hardware, and during this probing process, it's connected to then a laptop where we have our software. And no one with a naked eye would understand what it's saying unless they're trained, because it's very much so coming up in different wavelengths. So our base reading is a 50 hertz that represents balance. So if we go in and we probe, say if we probe the small intestine, that's part of the digestive system, and we see it jump up to 70 hertz, we know that's a very inflammatory type of a reading. Whereas if it drops down to say 35 hertz, we know then that that's going to be more of a weakened state. And then we take all of these, we take algorithms and then put it into this nice pretty report that you see here. So it's a pretty laborious process in terms of getting you this information. But the beauty is now that it's all laid out, hopefully it's a nice and pretty easy to read report. But what I want to do is break it down for you now that you have yours, or soon should have it soon, and help arm you with information in terms of how to put this information into use to see change. So knowing that this is your baseline, and Allie, jump in at any point if you have questions or if I'm missing anything that you want.
I do. Yeah, I actually do have one question that I want to ask right off the bat, because it's something that our women ask us all the time. So during our first one-on-one session, it's basically exactly like this. Em and I jump on a Zoom call. Emily's testing. I'm taking notes. I'm kind of, gathering information. And one thing that people always say is like, okay, I'm nervous. Like, I'm sorry, I'm so nervous. We're like, don't be nervous. What are you nervous about? But they're like, is this going to affect my results? Because this is the state at which my body is now. Or does testing work to where it's like, it's kind of a accumulation of how your body has been, in the past, however, many weeks or months? Like, how does that kind of translate to this?
Yes, this is very much so around the time frame of taking the samples. Roughly, I would say probably roughly 2 to 3 weeks around that time frame. So it's more cumulative around a shorter phase of time, not necessarily months or years. And the beauty of this type of testing is it's here and now. It's not like DNA testing, which is more genetic or anything like that. It's very much so in this moment right now. But if they're very nervous in that moment, or if they have their period, or if they had a stressful day at work, it's not going to impact it in the terms of their results in this session. It's that cumulative, probably 2 to 3 week period.
Okay. And that's exactly what our answer is too. We tell people to massage kind of the bones right behind your jawline, relax. Anything that comes up is not a reflection of like in this moment right now.
Yeah, exactly. And one of the things that I would say to people that are nervous is, I totally understand where they're coming from and why, because I mean, we're taking a deep dive into who you are, and that is a nerve-wracking thing. But at the same time, you're being tested for a reason because you want to know these things to better yourself and to make change. And that is something to celebrate and be excited about because knowledge is power. You know, you have this information, and sure, might see that your liver comes up at 40% or 30% or even 20%, and that in seeing that in that moment might not be the greatest feeling, but how powerful in knowing that there's something that you can do to overcome that. So I look at the system performance more as be excited about it if you can, because you're going to have so much power behind, being able to make these changes now. So
Absolutely.
yeah, yeah. So I was thinking, I want to jump into each of these systems, and so when you have your results right in front of you, you'll be able to take some nuggets of information and maybe put them into use, so that this information is super powerful for you. So the first one is the integumentary system, and one thing you can do from your dashboard when you log in is you can actually click on each of these and it'll say exactly what that system is. So like the integumentary is hair, skin, and nails. Most often it's the skin that we're looking at because the hair and the nails will follow, but you can do that with each of these systems just to get a little bit more information. But the integumentary is being the skin. If you see stress come up here, there's lots of different things that you can do in terms of reducing the stress. So whether that's taking Epsom salt baths or dry brushing or looking for other factors. So I'm a big fan of trying to find links throughout the report. And one of the links I look at is the liver and the digestive system. Oftentimes we will see stress in one of these systems, and one of them or sometimes both of them will then impact the skin. So by working on one of these two systems, oftentimes the skin will follow. And then if we take a peek at the nervous system, oh, one of the other things I want to touch on on the skin as well is take a peek at your body products. What are you putting on your body, and is it organic? Is it full of chemicals and things like that? And if so, maybe try to make some of those swaps. Or also, are you sensitive to something that's in one of the ingredients, which you would then know from the next section, which is the sensitivity section. Where then we have our nervous system, and here we're testing central and peripheral nervous system, and all the nerves that run through the spinal cord. So a lot of things can impact this. If you are a very high stress person, in that fight or flight mode, if you maybe are having some sort of deficiency that nourishes and feeds that nervous system, which we will know when we get to the next section in your nutritional imbalances, or if you potentially have some sort of toxin that's impacting this nervous system. And that could be things, the common things that we see often are chemicals and heavy metals that latch onto those nerve endings, viruses, certain bacterias, things like that. And so if we can slough that off, then we will see this nervous system start to balance out. But things that you can do to nourish it are, using red light therapy or meditation, yoga. You don't necessarily have to, when you're meditating, you don't have to do a formal meditation. I know for some people it's hard. So even going for a walk or, listening, zoning out to some music, things like that. And then our respiratory system, this is specifically the lungs that we're testing. And if you think about how we get rid of toxins, we get rid of toxins one of four ways. We breathe it out, we sweat it out, we pee it out, or we poop it out. So one of those four ways of getting rid of toxins, if you have any sort of stress in those four systems, then it's putting additional stress on the other detox pathways. So if you see stress here, it could be that your body's trying to get rid of some of the toxins, whether it's mold or bacterial things. There's a possibility as well where maybe you have a sensitivity to something that you're breathing in. If you have a sensitivity to dust or to pollen and you're breathing those things in, it's going to be a matter of fortifying and reducing that sensitivity to then reduce the stress here in the respiratory system. But what you could do, one thing I like to do is breath work. And I don't know if you guys have heard of her handle on Instagram is Breathe with Kimberly Rose. She has some awesome breathwork sessions on YouTube, and on Instagram as well that you can do. Some are short as 5 minutes and some are as long as an hour and a half. But that's a really great way to help clear this respiratory system. And then also check out your environment. I know Allie and Emily probably talk all the time about mold and evaluating that, but what's your environment like at school, at work, at home? Um, and then, whether that's mold or is that, chemicals or is it dust, things like that. So just taking a peek at home and seeing how you can clean that up. And the digestive system is probably our most common system that we see people having stress with. And what we're testing here is the stomach, small intestine, and colon. So when you get your results, to know what cyst or what organ or area is driving this specific system down, or any of the specific systems down, is to look down here, and you'll see we identify the top 3 or 4 most stressed areas right here. But then throughout the rest of this paragraph, we identify every single gland or organ or area that's driving every system above down. So for this example, you can see it's her small intestine that's driving this digestive system down. And I would say oftentimes when we see the small intestine coming up stressed, oftentimes that's almost always going to come hand in hand with food sensitivities. And this is, that's not always the case, but I would say often those resonating food sensitivities are hand in hand with the small intestine. So here within your digestive system, really evaluating what comes up in the food sensitivity section of this test, along with some of the nutritional imbalances, because when we're looking at what is stressing these systems, it really boils down to, well, the way I look at it is it really boils down to one of 2 things: some sort of nutritional imbalance that's starving this area from being able to work optimally, or some sort of toxin that is impeding in the bioenergetic field of this area and creating that stress. Those are the 2 most common things. Of course, food sensitivities are also very important, but that's typically a reaction to something bigger that's going on. So it's important to stop fueling the fire, but looking at the bigger picture in terms of what's at the root is more important. There's also the possibility of like a physical trauma or an emotional trauma in that area, which, if it's a physical trauma, obviously you would know about that if you were in an accident or had a surgery or something like that. But in terms of how we're looking through this now, that's typically how we're able to identify things. So within the digestive system, really, avoiding those food sensitivities, identifying the toxins that could be contributing to the stress here, and then also fortifying nutritionally. So the next section, the pancreas, we put this one all by itself just because it's such a powerful organ that we want to know specifically how this one by itself is doing. So lots of times we see folks that have blood sugar issues having this one come up, and lots of times that'll come hand in hand with other inflammatory markers throughout the rest of the report. And so really identifying those nutritional imbalances again, as well as any kind of toxins that might be lingering there. But you, as someone that might be having stress in this area, take a peek. One of the easiest things to do here is take a look at your sugar intake and try to cut down any of those processed sugars, just to help reduce some of the inflammation. And then, did you have a question, Allie?
No.
Oh, sorry. And then next is our liver and gallbladder. So it's just those 2 organs driving this one down. So in this area, someone might feel just overall general fatigue or unwell, maybe some nausea, bloating, trouble digesting. And so this one will often see a correlation with trouble digesting fats as well. So if this is you and you have stress in this area, it might be helpful to see how you feel if you are consuming a little less in terms of fat throughout the day, just smaller, more frequent portions versus one big dose in one meal. And then other things here are like castor oil packs. And if you're up for it, coffee enemas are great to help clear this area, as well as, anything that might come up in your regimen to help clear. Because this is a pretty important one, just because the liver does regulate so many other areas throughout the body. And then metabolism. So this is, yes, your actual metabolism, how you're burning energy. And also we evaluate it at like a cellular metabolism level. So if you think about your cells, you have billions of cells throughout your entire body, and each cell has a mitochondria at the center, which is the engine of the cell that produces ATP fuel and gives your body the energy it needs to function. So when we see stress in this system, this tells us that toxins have become intracellular, so they're inside the cell versus outside the cell where they belong. So oftentimes, like for example, if the lymphatic fluid gets pretty congested with toxins and that fluid is very crowded and there's nowhere else for them to go, they will actually impregnate the cell and go inside the cell. And that's where it can start to create stress in that mitochondria and allow your cells not to, you're not producing as much ATP fuel and potentially not as quick of a healer and more fatigue, things like that. So one of the big things here would be, getting your lymphatic fluid to drain, getting those toxins out of your system so that the toxins that are inside the cell have the ability to move out. And so this is a pretty powerful one to know exactly what to do. And you can do different things like, if you're able, and everyone's at different levels in terms of being able to detox and move around and things like that. So rebounding is great, sweating is great, lots of water, things like that.
Yeah, and for all those detox therapies, so when we're doing our one-on-one testing, like in person, or I guess via Zoom rather, we're giving, kind of like our women, what are your specific detox therapies? Because again, like you said, everybody's so different. So with this, in the same sense, we will have, if you decide to kind of do the Core 4 kit, and maybe we can even include it in, a resource here for just the creating balanced health. But, if you're a sensitive person, here's what we'd recommend for detox therapies. And that would be more of like, the dry brushing, rebounding, walking, Epsom salt baths versus, hey, if you've been at this a really long time and you know that your body can handle it, you might be a coffee enema person, and kind of get more aggressive with detox. So we'll try and give you guys as much, information, whether that's in the Core 4 kit or, maybe just within a resource for balanced health. But, what is a sensitive versus a non-sensitive person's detox therapies? What does that look like?
Oh, that's so good. I mean, so everyone's on such a different path in terms of where they're at and what they can handle. So that would be
Yeah.
interesting.
I mean, even like saunas, you think that a sauna would be fairly gentle. Not for a lot of people. It's
Oh
like,
gosh,
you
no.
know, it
Yeah.
pushes a lot and it's forcing your body when it's not ready. And especially if you're someone that sits in a sauna for 25, 30 minutes and you're barely sweating, that's like what we see. We have in our program, we have a forum, which, we ask all of our women to share a lot all the time. And that's part of the community aspect of it. But I can't tell you how many times people are like, big, huge win. I got in the sauna and was sweating after 3 minutes, which is so unusual for them. But once your drainage pathways are open, yeah, your body can actually start to allow to do these things. But sometimes it takes, conditioning it to be able to get to that point. So you don't
Yes.
want to just jump in a sauna all the time.
Baby steps for sure. Oh. Oh, amazing. Okay, so let's jump to the next section here, the urogenital. So this is kidneys, bladder, reproductive organs, and this would be another one of those critical detox pathways. If your kidneys aren't flushing and if you're not urinating, getting those toxins out, that's a pretty critical thing. A lot of people here, we see complaining of maybe chronic UTIs or frequency, fertility things pop up in this area as well. So one of the main things that we often see toxin wise in this area is a lot of heavy metals and chemicals and quite a bit of parasites and bacteria as well. So within this area, obviously, if you're dehydrated, that's going to create stress in this area. And that's a simple thing to do in terms of getting enough water in. I'm a big fan of half of your body weight in ounces throughout the day, just to kind of stay on point and get what your body needs. But then above and beyond that, if that's you're getting that amount, that's when I think looking at the regimen and seeing what additional you might need to help flush this area, that's pretty important. And then we have our next section is the endocrine glands, and this is hypothalamus, thyroid, thymus, pituitary, pineal, and adrenal glands. So we kept the pancreas separate from that just because, again, this is such an important one to know specifically. Now, the endocrine system and the nervous system, if you see these two stressed together, that's pretty significant because the neuroendocrine system is, I mean, that's the communication pathway throughout your entire body. So if you see that there's stress here, obviously your communication throughout your body is somewhat compromised. And so you might be struggling with brain fog or insomnia, depression, anxiety, basically anything, in terms of a lot of that cognitive functioning and things like that. So here, again, we see lots of heavy metals, chemicals. Those love the endocrine glands. They sort of work as magnets to those metals and chemicals. But there's other things like viruses and bacteria that really impact this area as well. And it would be very similar to your nervous system in terms of really trying to manage your stress and then leaning into your nutritional imbalances, food sensitivities, and the regimen to help really work on clearing the stress here.
So for fertility issues, because that is a big, issue, and we see that a lot. You mentioned that came up or kind of can be a result of having a lot of dysfunction in that urogenital. I'm assuming you'd also probably see that for endocrine.
Absolutely. Yep. Those would be the two areas we see the most for sure.
Yeah.
Yep. We have so many amazing stories of fertility. It's pretty wild the different things that do come up. We've seen one lady in particular where she was a little nervous to start any formulas, and she had been trying, I think it was over a year, and they are struggling. She decided to start one emotional formula, and about 6 weeks after starting that emotional formula, she conceived.
Yeah.
Yeah. So
The emotion aspect is huge.
Yes. But of course it's different for everybody. And then our locomotor system. So this is our whole structural system: muscles, joints, ligaments, connective tissue, and we actually categorize fatty tissue in this area as well. So think breasts, brain, things like that. But a lot of the things that impact this are going to be those nutritional imbalances and the toxins, but also, how mobile are you? If you're a pretty sedentary person, it's important to stay moving. Just body in motion stays in motion. So, but do it within reason. If you are bedridden, obviously don't push yourself too much. I don't know if many of you know my story, but I was bedridden for about 4 years, and it was one of those things. On the days I was cognitive enough to be able to think about it, I was stretching from bed and doing my best to move those joints and move those muscles. And if that's where you're at, simple things like that will help. But then again, if you're more mobile, if you can walk, or if you can actually get a sweat going, that's great as well, because that's going to fortify this area. But do it within what you're comfortable with. But then additionally, this would be a good thing to look at in terms of the inflammatory foods and removing those and getting more of the nourishing foods that are going to fortify these joints and muscles and things like that.
So would you also see this one being a little bit more out of balance for someone who's going through Lyme?
Oh,
I
for
mean,
sure.
with the joints and kind of body pain, that kind of thing.
Yeah, any of those chronic things, absolutely. A lot of those toxins, a lot of mold, a lot of different bacterias,
Yeah.
a lot of viruses will really impact this area hugely. Yep. And then our blood and our cardio kind of go hand in hand. Cardio is just the heart. Blood is the integrity of the blood. And additionally, we see this one come up more specific with the blood. If someone has very high or very low blood pressure, we might pull stress here. But then, of course, looking throughout the rest of the report, we can see nutritional factors or toxins that might be contributing to that. But the integrity of the blood is going to be more toxin wise. Is there certain toxins resonating in this area that just need to be cleared? And same thing with the heart. This is going to be much more nutritional focused. And additionally, we see quite a few toxins that might trigger stress in the heart. So knowing what those are and clearing them, it's pretty impressive just how quickly we see that these two systems balance out. And then our lymphatic system, we test quite a few different areas within the lymph system. This is going to be our ear drainage, sinuses, teeth and jaw drainage, and then a whole bunch of different lymphatic points throughout the body that we test. And so if this area comes up for you, it's pretty important to work on clearing it. There's a whole bunch of different things. I know Allie just mentioned there's going to be a resource guide, and do what you're comfortable with and what you have access to, whether that's a formula that helps clear the lymph, or if it's a lymphatic massage, if it's dry brushing, things like that. Because once we have this moving and clearing, it helps to really keep the rest of the pathways open, and also helps to prevent any of the stress within that mitochondria. And then last but not least is the immune system. And these two, lymphatic and immune, are two that we see come up often, because if you're resonating with a lot of toxins, your lymphatic system is busy trying to clear them and purge them out, but it's just stagnant and not able to quite get them out as quick as possible, your immune system is going to stay in overdrive trying to clear them on its own. And so, of course, that's going to, an immune system that's constantly working and trying to clear is going to get stressed. And so once we clear this one, oftentimes this one will follow pretty quickly behind. So that's your benchmark of where you're at. And so this is where you're at. And then as we go through the report, we're able to start to understand why there's stress in some of those areas. And that's where it's really powerful, because you can start making some of these changes. And so for the resonating sensitivities, these are, you can see all the headers. These are all the different categories that we test. And then underneath is everything that specifically came up sensitive to you. Now, if you want to see a full list, you can click this little link here, and you can click, say, on fish, and see all the different fish we tested you against, or all the different meat that we tested you against. So if you're curious if we tested you on something, you can kind of reference that. But these are your resonating sensitivities right now, and that's different from an allergy. A sensitivity is typically, you can clear it pretty quick, where an allergy is more forever. And the way we test, it's nice because we're looking at it more broad spectrum versus just how do you react when your body is exposed to this. It's more, how does your body react to it, and it looks at it from a few different angles. Not only is it something that potentially is reacting because you have a jeopardized gut lining, but also, do you have a difficult time digesting fats because your liver gallbladder is congested, where you could see a bunch, like, how random to see a bunch of oils come up sensitive, but that could be because you're not digesting your fats that well. Or if you resonated with mold, it's not uncommon to see sugar sensitivities come up. Those that maybe struggle with Lyme, it's not uncommon to see wheat and flax come up as sensitivities, because Borrelia feeds on those. So there's a whole bunch of different things to kind of piecemeal these results and try to understand them at a deeper level. Some others that might be interesting for you to know about would be certain viruses feed on eggs. Those with estrogen dominance, they'll often have soy sensitivities as well as plastic sensitivities resonating. Those would be a few of the big ones. And then if you see certain meats or shrimp sensitivities, it's not uncommon to see that person also resonating with parasites. So the beauty is, if you clear the parasites, oftentimes the meat and the shrimp sensitivities, things like that, will subside. Or if you clear the gallbladder, a lot of the fat sensitivities will subside. So that's the beauty of a sensitivity versus an allergy. If you can work on really being diligent for, say, 3 to 4 weeks in avoiding these as best you can, oftentimes they will work their way out. Just that avoidance will help them subside. Additionally, if you are working on helping your gallbladder, or you're taking a formula for it, things like that. And then one other thing too, so dairy. For example, say you see cow's milk come up as a sensitivity, but you don't see cheese coming up as a sensitivity, or yogurt or something like that. It's different because milk in its in one form is different once it's processed down. The enzymes are broken down, so you might be able to handle it better. Same with, say, you have corn come up as a sensitivity, but not popcorn. So even though they're in essence the same food in its origin, the way it's processed changes its structure, and you can handle it in other forms. And then one question we actually do get quite a bit is if you had a cheese sensitivity, it comes up as cheese mix. And that cheese mix is any kind of cow cheese. So that does not include sheep or goat cheese. I think that's the only one that might be a little confusing. But yeah, so after you avoid these for say 30 days or so, you can start dabbling with adding them back. But just be sure to add them back very slowly to see if you react, or if you just want to test again and see if it's cleared, and then feel comfortable adding it slowly back in. That works well as well.
So one question, so if someone is working, and kind of to backtrack is like how we kind of go about, I mean, for us, it's like doing foundational things, kind of going in a little bit of an order to open up those drainage pathways before someone goes to like, attack parasites, which I'm kind of assuming, right? I guess we didn't really like cover this too much, but is that kind of how the process works for your remedies? Is you do things in phases, or is it really kind of, parasites we think are showing up, so let's address it within the remedies, or do you go in phases like that?
It really depends on the person.
Okay.
So we specifically test to see what that person needs the
Right.
most. So we might see that someone needs a parasite formula, but we would never address that without drainage included.
Got it.
Where someone might come up with parasites, but not a single parasite formula because they just can't handle it yet. And
Yeah.
they either need strengthening, or they need draining, or they need both of those. So it just really specifically depends on that person.
Okay. And that's actually, very similar to what we see is like, we know that parasites are there because we can actually compare it and even look at blood work as another example. But that person, it's not going to show up as a solution or a problem because the body like clearly is not ready to address it. But if you're someone that does, kind of, as you mentioned, making those connections between like, meat, because that iron can kind of feed parasites, or raw fish, sushi, pork, those are all kind of like parasite feeding foods. So if parasites show up, you would maybe want to even avoid those like longer than the 30 days or so, just because you know that it's there, you haven't really addressed it, parasites are still going to be a problem, right? Would
Oh,
you say that's
absolutely.
fair? Okay.
Absolutely. Yep, absolutely. 100%. Such a great point. Yeah, so that's the sensitivity section, and then the next section is nutritional imbalances. So these are resonating deficiencies. So when you get yours, you'll see all these main headers: amino acids, fatty acids, vitamins, all these main categories of nutrients. And then typically you're going to see 3, occasionally 4 nutrients listed under each that you are low in, that you're resonating as low. So you can see under each of them, there's food sources of potent foods that have these nutrients in them. So in a perfect world, you're going to get these nutrients from whole food sources. Every so often, someone might resonate with a specific formula because they are that low in it. And there's a couple things that I'd like to point out here too. So someone might say, okay, well, I eat magnesium rich foods all the time. How could I possibly be low on it? And really, it's one of 4 things. One, if you go back up and you look at your digestive system and you see that there's stress here, you're just not going to be absorbing as well as could be. And so you're low on it. 2, certain toxins will either steal or keep you from utilizing nutrients the way you should, just like you were mentioning parasites and iron and things like that. So some of those toxins will really impact it. The food supply obviously is just not what it used to be. So you could eat a lot of a certain food and still just not get enough. And then lastly, and we see this a lot with like vitamin B's and things like that. But if there's a certain function in your body that is really in a lot of stress or an overdrive, you're burning through the nutrients that help to keep that function balanced. Like for example, if you're a very high stress person and you're working 12-hour days and you're coming home and have 3 kids and you're just you're frazzled and have really high stress, you're probably burning through your B vitamins. So even though you might be eating a lot of B vitamins, you're still depleting them at the same time. So there's a lot of different factors in terms of, even though you might be eating these, why they could be coming up low. And you might actually even have more than what you see listed. Maybe you go to the doctor and you come up that in your blood test with low vitamin D, but you don't see it in this test. That's because the way we're testing is we're identifying the priority first. What are the lowest resonating nutritional imbalances? So it's not that maybe the vitamin D is not low. It could be that the vitamin E, B6, and B12 were a bigger priority. Because if we send you a report that has 10 nutrients in each category, it's going to be overwhelming. And we want you to focus on the priority first. So that's why you'll see it listed like this. And when you look at some of these, it's nice because they can be very indicative of other things that might be going on. So I don't necessarily need to go through the full list here, but I'll point out a few of them, like carnitine. Acetyl L-carnitine is a formula that if someone's low enough, it might resonate. But also, carnitine is really important for nervous system health, neurotransmitter balancing. So, someone that is low on this might have brain fog. They might have trouble concentrating. They might be depressed. Things like that, where it makes a lot of sense, especially in this report, and seeing this stress here in the nervous system and the endocrine system, or someone that is low in glutamine. Glutamine is really important for muscle recovery. It's important for gut health. And if you recall up here, they have that stress in their locomotor system and in the the digestive system within that small intestine. Some of these others, so the enzymes, I like to hit on this one. So certain enzymes break down certain foods. So protease digests proteins, lipase digests fats, amylase digests carbohydrates. So if you're low in one of these, you might struggle in breaking down your proteins. Not only is that going to create a lot of stress within your digestive system, but you're also not going to get the amount of nutrition out of that food that you're eating. Same thing with lipase. We all need fats, but you might do better in eating your fats in more of a grazing style versus one large fatty meal or one heavy protein rich meal, and just do more of that grazing style, because too much work on your digestive system is going to take that energy away from you and put more stress on that digestive system. So that's something to kind of keep an eye on. And then hydrochloric acid is produced in your stomach, and sort of like that first line of defense. So not only is it breaking your foods down, but it also helps at killing off some of those bacteria and parasites and things like that when they're first introduced into the body. So if you're low on this, take a peek and maybe try to incorporate some of these first thing in the morning or maybe a while before you eat, just to stimulate that hydrochloric acid production. Now, this is an interesting example because here you see this person is low on all these fats, which are critical for the entire body. They help nourish, they work as an anti-inflammatory, but they also struggle with digesting fats. So this would be important to really be conscious of getting these good fats in the diet regularly, but in smaller, more frequent meals throughout the day.
Yeah, it's cool to kind of like tie everything together and like start to, put the puzzle pieces together, because that's exactly what I was thinking. I was like, okay, so lipase is deficient and they're also needing, higher fat. We saw that they had liver gallbladder dysfunction. And then when you think about liver gallbladder dysfunction, or what hormones need or cholesterol needs to even be created, is fat. And so that's where you can start to see probably endocrine dysfunction when you're talking about hormonal or fertility. I mean, it all ties back into what makes up what. And when that's not there to make it, it's not going to be able to do that.
Yeah, absolutely. It's just like when you look at the results as a whole, you
Yeah.
start to see these pieces of the puzzles that jump out, and it makes the journey quite a bit easier. Like, okay, I need my fats, but this is how I have to eat them, or I need to take this gallbladder formula to help myself, actually digest them better, certain things like that. So,
and we totally understand too that like you guys might not necessarily, like, this is our job. Obviously, like, we have this knowledge, we've been trained in this and learned, over many, many years. So if you're not like, okay, I don't understand how the puzzle pieces get together, like, we're going to give you resources for that as well. But I think this kind of empowers you to become your own practitioner, to say, figure out, well, what do B vitamins do? I mean, you can kind of relate that to knowing, by doing some research, B vitamins are really important for methylation. If you're having methylation issues, that could also translate to liver. That could translate to, a whole host of different things. So, it's not impossible for you guys to kind of like, put your investigative hat on and kind of figure this stuff out. If you want to, it's not totally necessary to heal. You don't have to understand. We always say, like, you don't have to, we all did this basically because we had our own, health issues and then decided to do this as a career, but not everybody wants to do that. You don't have to become an expert in this. So there's, people to help you kind of break this down and resources along the way. But it is really cool if you want to kind of get into it to start to figure out how these things all relate to one another. It's pretty fascinating.
Absolutely. And something you can do as well is, it's great to see the correlations, but at the same time, here, you have this list of foods that would be really great to incorporate. And one thing to point out, these are static lists of food sources. So you might, for example, be sensitive to brown rice, but it'll say brown rice up here. Just know that these are static lists, so not to have the brown rice if you're sensitive to it. But if you can see these lists and know, okay, well, if I just focus on consuming a little bit of all of these, as much as possible from day in and day out, that's going to help support you. And if you work on avoiding these for that month, that's going to support you. So you don't necessarily have to investigate if you don't want to, although it is really fun. although that's coming from someone that geeks out on this stuff. So just a couple more little tidbits I want to point out on these nutritional imbalances before we jump to the next section is, just some more fun examples. Iodine, great for supporting the thyroid, and it purifies the blood. Vitamin E. Now, this one, whenever I see vitamin E come up, I think I take a peek and I look at, did they have a plastic sensitivity? Did they have a soy sensitivity? Because lots of times those might be our estrogen dominant people. And if that's you, taking into consideration what could I do to become less estrogen dominant? And that would, of course, be, avoiding the things that came up sensitive, but incorporating other things like vitamin E rich foods, green tea, cruciferous veggies to help to break down those, estrogens. So again, just following what you see here will help without even necessarily needing to know the nitty gritty as to why. It'll be really beneficial. And then this is the toxin section. So these are resonating toxins. And when we're analyzing your hair and saliva, we use the analogy of an onion. So we are testing you to see what's your outermost layer. For example, you may have been exposed to a virus when you were a teenager and you're 40 years old now. Well, if that virus is not still at your surface and one of the things that's most negatively impacting you, we don't necessarily want to jump to that virus and start working on it, because we're going to stir the pot and make you feel worse and potentially not even do anything except, create some more stress. So the toxins, as you see them, are the ones that are most negatively impacting you right now and the easiest to clear. That's the beauty of this type of testing. It's methodic to make it easy. So we test these 6 different categories, and you can see we have the origin of all of the different toxins listed, and we see stress come up in different areas of the body for all of these. It could be that bacteria is really common in the nervous system, the lungs, the lymph, the digestive system. Metals and chemicals are really common in the nervous system, endocrine glands, kidneys. Mold, I feel like mold impacts us throughout the entire body. Parasites are really common in the digestive system, lymphatic, pancreas and liver. And then viruses we see really common in the nervous system, endocrine glands, lymphatic system, locomotor system. But that doesn't mean that any of them couldn't impact you in different areas of the body. That's just pretty common in terms of where we see those correlations. And one of the big things here is we are testing for resonating toxins, which means you've had an exposure to a toxin and you've held the pattern of it, and that's creating stress. It does not mean a diagnosis in any way, shape, or form. So just kind of keep that in mind.
I have a
So
question real
yeah.
quick on this, and you might already go into this next, but I mean, what typically, I mean, if I were to see this, I would say, like, oh, wow, okay, so like all the things showed up for me. Awesome. Like, but how common is it? Because we talked about this earlier. It's like if you have a pulse, you have parasites. There's likely low levels of mold wherever you live. It just is a matter of how well, your body handles that, but also at what level that is. So what is like typically, is this kind of an aggressive or more chronic case, or is this pretty normal to see, this many?
Yeah, well, I'll give you, well, I definitely want to give you one example, but I also want to say first, it just really depends on the person. So, depending on the person, someone might have some very clear toxins that are hitting them very hard, and that's the most predominant thing, and it's overshadowing everything else. And so, we might not see this many come up. We
Okay.
also might see someone extremely chronically sick, and they are just not purging as well as they need to, and we're finding so much, like this
Yeah.
person for example. But also when we're testing, we are testing to see what impacts them, what is negatively impacting them. And this, I like to use this example all the time. So me and my brother, when we were kids, we grew up in northern Wisconsin, and it was nothing to pick ticks off. Like we played in the woods all the time. I mean, we would pick 5 off a day. It was just like part of growing up, and didn't think twice about it. Well, when I was 25 and I got sick, it was those bacterias, they were deep inside. And when my body was very stressed and very weakened, that's when they came out of hiding, and it turned into Lyme disease for me. Now, my brother, he probably picked off 10 times more ticks than me, just because he was a little bit more outdoors than I was. He never had struggled with it. He never, I guarantee he was bit by ticks that carried Borrelia, but he never got Lyme disease because my makeup was different than his, and I developed Lyme disease where he didn't. So this is, and you might see this too, like say you're tested, your is tested, your kids are tested, you have all these people in one home. Maybe there's mold in the house, but it only impacts a couple of you. And we're going to pull those molds on that person, whereas the rest of the family might not be impacted by it. So that's
Yeah.
something also really important to remember when it comes to these toxins, just because everyone's so different. Everyone's pathways are different. Everyone's stress levels are different. And so it's very unique to every single person.
Yeah. And then another question on this too, like, is it in some sense, like, I mean, like we say, information is information and it's all good information because you have some answers. But for example, like, when I did my first stool test at one point, some things came up and I was kind of like, oh, it's actually not as bad as, I would have thought. So then I started to do all the biofilm busting, opened up drainage pathways, retested it. A lot more stuff came up, which to some people you would be like, oh, well, that's not good. But to me, I was like, no, this is great. Like, I'm getting into the nitty gritty of what was there. It
Yeah.
just wasn't ready or able to be uncovered. So, in the same sense, could you look at it like this, where you're like, oh, okay, so yes, all these things are there, but it's because they're ready to be seen and I can actually see them. We've done a lot of the biofilm work.
Yep, that is exactly the case.
Okay.
And when something like that happens, for example, say someone's never, done any kind of formal detox or a formal regimen whatsoever, we might even see once they start up here in the system performance,
Yeah.
it's not going to be this perfect process of seeing reduced percentages, or improved percentages, I should say, across the board, because, as we're rebalancing, maybe it's creating a little bit more stress in the digestive or the liver or the lymphatic system as we're uprooting things and moving things. And as you said, like breaking biofilms, we might see a bit more stress. Over time, the general trend will be improvement from our experience in the past. But that's just kind of something to know, that it's not uncommon to see a bit of regression in some areas as that happens. And one other thing that's really cool that happens with the toxins as well is, we might see over time where, let's say a resonating tick-borne bug didn't come up in the first couple scans, but then it eventually presented itself because it was just too deep before, and we couldn't see it until we cleared some of those upper layers. So
Yeah. Well,
Yeah.
and things hide in other things too. There's a lot of things that hide within, like candida, I'd say is a great one that pops up at any time. Like when you start to get rid of parasites, viruses, all these things, it's like, candida can pop up. There's more bacteria that gets released within things. So it's kind of, yeah, it's like an onion is, all this stuff starts to come about and hide in different various forms.
Yes, that is so true. And one of the beautiful things about testing for a regimen. So, say you see parasites come up and you don't see a single formula resonating to address them, that is quite significant. Or heavy metals. Heavy metals are a very difficult thing to clear for some people, just because that's a harsh detox. You really feel it as it leaves. Um, well, if you don't see a specific formula for either of these, or any of these, I should say, it's because your body is not ready to specifically address it yet. Maybe you need more drainage. Maybe you need more fortification before you can handle something that intense. Or on the flip side, it could also be that in a perfect world, our bodies get rid of this stuff on its own. Unfortunately, we live in a world where we have to do a lot more formal cleanses and be a little bit more conscious about how our body is processed and what we're exposed to. But if we support enough with drainage and fortification, hopefully your own body systems will kick in and clear these metals on its own, or clear the parasites on its own. Now, I won't say that it happens all the time, but it can happen. And if that's a possibility for you, that's great, because our bodies need to learn how to do it on its own again. And hopefully with a regimen and some of this information, yours will kick in and start doing it on its own. Or in a subsequent scan, we see those formal parasite formulas coming up, or those metal formulas coming up. So
Yeah. I mean, we see people pass parasites drinking king coffee because it's got reishi in it and it's just something that people do, or drink daily. Or on the flip side, doing an emotional detox, or if you're really kind of working on that emotional component, the second you can let go of some of these, more, or work through a trauma, like that can allow your body to actually release other things. And people have, passed parasites by doing breath work, so it's
right.
pretty fascinating to kind of see the body. It is self-healing. It should do. We just need to remove all the roadblocks and all the crap in the way.
Yeah, yeah. Oh, that is so true. Oh, well, let's hop into, we have just a couple more sections left. This is our hormonal section. So hormones are not the root of the issue, but they continue to paint a wonderful picture in terms of what's going on and how can you support yourself. Um, so you'll see either high or low hormones listed here. And oftentimes, as you work through clearing some of these toxins, as you work through fortifying these systems and avoiding certain food sensitivities and getting more of these nutrients in, a lot of these will balance out nicely on their own. But this information is powerful. For example, say you see high estrogen coming up. This is going to be more like your estrogen dominance. Taking that into consideration of, okay, what can I do to work on clearing these estrogens, working on that liver and getting that green tea, getting those cruciferous veggies will support this. High cortisol is very, very common. We see this as probably one of the most common hormones that we see in balance. So if you are that high stress person, that high stress can come from a few different things: emotional stress, mental stress, physical stress, whether it's physical stress you're putting on yourself, or physical stress from some sort of toxicity or something internally. So identifying what is that stress and how can you work towards calming it down. If it's more of an emotional or mental stress, taking time out of your day, whether it's journaling or yoga, things like that could be supportive. Low testosterone, which that can be for men and women, just like high estrogen can be for men and women. Low testosterone is a surprisingly common one that we see as well, where supporting through an herb like maca or carnitine, doing interval training if you can tolerate it, and also even removing some those estrogens, because estrogens will impact the testosterone levels. So certain things like that, as you get to know what this hormone means, you can just tweak your lifestyle and things like that a little bit. But oftentimes, as you work through all the other information throughout the report, these will start to balance nicely without having to do with anything too aggressive directly for them. And then the last section is the balancing regimen. And so this is where we are testing your samples against thousands of different possible formulas. And we are identifying roughly 20 through a filtration process where we're finding the specific patterns of the formulas that match with your energy to work towards balancing it and bringing you back to that perfect 50 hertz. We come up with 20 different formulas. And then the practitioners go back, they review your health questionnaire that should include your any other, supplements or medications that you might be on, the information throughout the report. And then what they do is they hand pluck the ones from this custom list of 20, but then go back to test to make sure that synergistically they test well together. And then that's what you're going to see listed in this final regimen. And it's going to be a combination of herbs, homeopathic formulas, and nutritional support. And you're typically going to see that sometimes someone maybe can't handle an intense herb or something like that, but most often you're going to see that trio. And why we like that trio is the supplement kind of goes in and gives you that foundational support, that heavy nutritional support that you might need, where the herb goes in and does the job for the body. It's a nice intense formula, and it kind of does what your body needs that heavy support for. And then we have the homeopathic leg, where when you take that, it's reminding your body how to do it on its own. So it's a pretty powerful three-legged approach. And like I said, not everybody always can tolerate an herb, or not everybody can always tolerate a homeopathic formula, but typically you're going to see that. And then the nice thing is you're going to have the standard dosage here, along with specifically what this formula is for, all the ingredients listed in it. And we're a big fan of always starting slow for that first week or so, maybe a quarter dose or half dose, and building up to the full dose, just because this is shifting. You're shifting a lot internally, and we want you to ease into it and not be hit real hard or anything like that. Now, some people do detox quite a bit, and if that happens, you can always back down and then build back up. Some people don't detox that heavy detox at all, and they just feel really supported over the course of this is typically a month-long supply. But those people that do feel some heavy shifts, if it's too much, you can always call or shoot an email, and we're here to support you. And but I would say that's not typically the case. It's usually a pretty gentle, effective process. And you can just simply add these to the cart here, and you can check out, but be sure to use the code RCF5 to get a discount. And then just add those to the cart, and we'll ship them directly to your house. And now, if you're looking for a bit more support, like if you want additional support, you can always click this little book consultation button, and you can book to review this with one of the practitioners at a deeper level. A 60-minute call would definitely be best to have the time to go through a full scan. But if not, this is your baseline. And I would say most people will finish their regimen and often test again. And doing that 3 times and having that specific regimen, the specific information for nutrition and food sensitivities, a sweet spot seems to be about 3 scans back to back, with really that customized approach and being able to tailor and tweak things as you go. So it's a lot of information, but as you pull those main factors from it, it's pretty amazing how quick things shift, because when we give the body what it needs in the right order at the correct dose, things happen pretty quickly. So I know I've just thrown a ton of information. Allie, do you have questions?
Yeah, I'll kind of like wrap this up with maybe just a few questions that I thought of kind of towards the end as you're talking. So just to kind of, I guess, go in order, when you said retesting, how often do you like to retest, or how much time? Is it really just when you finish your remedies, then retest, or how much time in between?
Yeah, typically, when you finish your remedies, then that's a perfect time to retest. It seems to be that people that test back to back seem to make more progress in the long run, just because it's kind of like the snowball effect. You get the ball rolling; it's a lot easier to keep going versus you've done all that work in clearing and fortifying versus starting all over. So yeah, just test, take the formulas, tweak the lifestyle and diet, then test again, and then typically 3 times back to back is pretty profound, although sometimes just one scan by itself is pretty profound for some people.
So that would be around like 30 to 45 days then.
Yep. Yep.
Okay. And then when you mentioned booking a consult, so yeah, we, like through RCF, we're not going to be doing these one-on-one downloads. We just don't have the capacity. Like we want this to be a DIY. We want you guys to do this on your own, invest in your own, whatever that means for you, whether that's kind of breaking this down and taking your own protocol and relying on, creating balanced health as your practitioner. We will have, some practitioner recommendations if you feel like you need one-on-one support. So with them booking with someone to go over their individual scan, I know we talked a little bit about this, but maybe you could kind of elaborate on if you're able to test this or not, but like those specifics that we talked about. So like, mold, bacteria, that'll come up. Is it able to be that specific? And sometimes like we feel like we might know, or that might come up, but sometimes it's like not even really helpful to know that specific, because then that's where the emotions start to come into it. And then people take a deep dive on like, oh, well, this came up. And so, as we mentioned before, like we're very cautious, both of us with our businesses, about like legality and safety of an individual. And so we don't want something to come up where someone Googles it, thinks that they have this. This is not a diagnosis whatsoever. So like, are you able to test the specifics? But then if not, I mean, can you explain why it's beneficial to maybe not need that information?
Yeah, we do test for the specifics. We only list the origin of them in the report, though, just because we don't want any confusion of a diagnosis, because we're simply testing the patterns of these toxins. Because just like like a snowflake is very unique. It has its own, every snowflake is unique. Every toxin is unique. It has its own specific wavelength and pattern, and that's what we're testing for. So it represents an exposure to the energy of it versus being diagnosed or anything, which we absolutely 100% don't do. But during the consultation, if you would want to do that with one of our practitioners at Balanced Health, we can go through those specifics. But with that said, you have that information in terms of the categories right here. If it doesn't matter to you, you have that information right there. And to take it a step further, you're going to get the information and the formulas needed to help clear these. So, for example, berberine is a great biofilm buster. It's also great for specific bacterias and parasites, as is cat's claw for specific things, and artemisia. These are all great formulas to clear a lot of what is found right here. So, in my opinion, do you need to know this information? No, but if you're curious, a consultation would be great.
Okay. Yeah. Em and I are kind of on the same page as that. Like when we give a result from, a one-on-one session, we're saying parasites showed up, mold showed up. We're not necessarily saying, it looks like strongyloides is in the brain, like unless it's like a very clear energy. But again, it's not a diagnosis. So what does that do to help somebody? I feel like it oftentimes just causes more stress. And kind of like the point of doing this is for you guys to be able to have this information, yes, this is great, internalize it, but then use the solutions and move on with your life and feel better. Like it's not really like so helpful to kind of go down like a, terrible Google rabbit hole of all the things and when you got it. And, like it's just,
Yeah,
it's not great.
it's so easy to get hung up on that. And I think some people do get a little hung up on it when in the grand scheme of things, like focus on the rest of the information in terms of, these nutrients that will support clearing it, these food sensitivities that will starve it, the formulas that will clear it. That's where the power lies versus getting hung up on saying, I have Borrelia, because you're taking ownership to it and you don't want that.
Yeah, I agree. I think for a really long time, like I needed to know, had to know, wanted to know, why did I get Hashimoto's. And like, you know, in the past, however, it's probably 2 years or so, like, it doesn't matter to me. You know, it matters that like I've identified it, and it matters that I've been addressing parasites and mold and all the things, you know, but like to kind of like pinpoint it to one specific incident. And that's the thing, is there really isn't, as you can see with this, it's never one thing, right? Like
Yeah.
it's
It's a
never
perfect storm. Yeah.
so the body works as a system, and it's, you know, only so helpful at certain cases and certain points. Okay, let's see. What other questions did I have for you? One thing I wanted to explain kind of quickly, because when we talked about this out loud, we're like, oh, this is like actually like the perfect thing. So if you guys wanted to get started with our core four, which is like our, you know, Emily and my protocol for kind of starting that foundational work, which is addressing biofilm, healing the gut, you're on a binder, and moving the bowels. Those are our 4 components to get the ball rolling. If you were to do that and order your Creating Balanced Health scan, which I guess at this point, because you're watching this, you would already kind of have done the scan, or at least ordered it, right? So you might not have gotten it back yet, but kind of the, you know, way to go if you wanted to was you can do our core 4. And then by the time you actually get these results back and you get your remedies, you'll have done kind of that 30 to 40 days of the RCF core 4. And now you can move on to the remedies from Creating Balanced Health. So we're not really like associated in any way with the remedies for Creating Balanced Health. It's totally separate, but we, you know, obviously align with all the solutions and the way that it's testing. So Emily and I are fully supportive. We want you guys to order through them, and kind of, you know, decide to see if you want to retest or kind of go from there. So that's kind of 2 options, or you can totally just wait till you get results back. Just start with the remedies through Creating Balanced Health. Totally up to you guys. But that is kind of an option to do a, you know, a 30, 45 days RCF, 30, 45 days Creating Balanced Health, which kind of matches up nicely. Because it does take about, I mean, I guess if you want to run us through a quick timeline, by the time if you just placed your order, how soon can they expect to get their kits in the mail? Is about like 1 to 2 weeks allow?
Oh, to get the kits in the mail? No, we should have it. We should have them to you within, I would say, 3 to 4 days.
Oh, okay, perfect.
Well, I mean, if you're in Hawaii or Alaska, it might take a little bit longer, but anywhere in the U.S. besides those 2 states,
Okay.
I would say max out 4 days.
And then around 3 weeks to get the results back once you send in your kit.
Yep. So once you send your samples back in, and there's a prepaid envelope, well, you all probably know this already, but you drop your samples back in the mail. When we receive them, we will shoot you an email, say, hey, we got them, we started working on them, and we will let you know as soon as they're ready. From that date, we need about up to 3 weeks to get them turned around to you.
Perfect.
So, yeah.
Okay. And then they hopefully, this is on our website, because I remember we talked about this as well earlier, but making sure that you guys hopefully clicked the option that said give full results to you, the, you know, client. So it's not coming to RCF, it's ideally coming to you. It'll come to us as well, I think. But if you didn't click on that and you're like, I have no idea what you're talking about, you can always send us an email and we'll kind of work that out. But these results will be coming directly to you.
Yeah, they'll go directly to you. But if you want to have RCF have a copy of it when you're filling out, so don't forget, and you probably already did this, when you register, but then once you log in, there's a button that says submit for myself. You click that, and we have to have you fill out this form for consent for us to work on the samples. When you fill out that form, it will ask for the referral, and make sure you put RCF in there. And then at the end of that questionnaire, there's a little button that says agree to share this information. If you click that, then RCF will get a copy of your information on their dashboard if you'd like them to have it. So again, I don't know if you guys aren't going to be going through any of these results, but if you want them to have a collection of that information down the road, that would be the steps to take.
Got it. Okie doke. And I think I just double checked our email. I think our code is RC Formula 5 for the remedies, but we'll double check it. It's either RCF or RCF Formula 5, but it'll be on our website. So you guys don't need to pay attention to this video for that. We'll have it all in writing somewhere. So, all right. Well, thank you so much. That was so informative. I feel like I can't believe we're so lucky to have this as an amazing resource for you guys. Seriously. Just you donating your time and kind of going over that is so helpful. So we really appreciate it. And then, if you guys want more information and you want a just personal call, that is totally up to you. And we'll have all of that information on our website as well.
Amazing. Well, thank you so much for having me on. And also anyone that has questions in terms of the testing process or anything like that, you can reach out to Balanced Health at any time as well. So
Perfect.
yeah.
All right. Well, thank you so much. We really appreciate it.
Likewise.
Okay. We'll talk to you soon.
Bye-bye.
Bye.